Welcome to Plastic Review. Let's go through the latest papers on aesthetic plastic surgery of the breast for these months of July and August 2017. So we're going to start off with a paper from the July issue of PRS. It's on the maintenance of certification and CME section, and it's an evidence-based medicine review paper on breast augmentation by Michael Schwartz from Westlake Village in California. Now, I think credit should be given to the author. It is extremely difficult to summarize such a broad topic as breast augmentation in just a few pages in PRS. I think the author does an excellent job in going through the several topics to cover all the controversies or decision-making parameters that go into breast augmentation surgery. I think that definitely the gold standard for such a review is the one by David Hidalgo and Jason Spector back in 2014, also in the CME section of PRS. That was and still is the best review article on breast augmentation till the moment. And I think this paper by Schwartz does show in the text his preference for shaped devices. In fact, he does reference in the text his paper on the use of these shaped devices for breast augmentation. And one example of this is a table that is presented, which is actually extracted from a level 5 evidence paper on the misconceptions and reality of shaped devices in breast augmentation. Nevertheless, it's a good little review. I think one of the problems also is that, of course, there's so many papers that have been published in 2017, which the author did not have access when his paper was presented. In fact, the paper was received by PRS for publication in August 2016. The recent papers have definitely changed a lot of the evidence-based medicine that we know today. In August 2017, breast augmentation, I'm referring, of course, to papers such as the one in January PRS by Carlos Rubi and Jose Angel Lozano on level 3 study on no difference on outcomes between breast augmentation between shaped versus round devices, and of course the level 1 study on March PRS by David Hidalgo and Andrew Weinstein on the or no advantages of shaped implants versus round devices in breast augmentation. We have to mention, of course, the paper published also in March in the Aesthetic Surgery Journal by Bill Adams and colleagues, noticing the high degree of rotation of anatomic devices. Up to almost half of the patients they studied with high definition ultrasound had an implant with over 30 degrees rotation with shaped implants. And of course the two studies from PRS from Mark Clements and colleagues regarding the problems with textured devices and breast implant associated ALCL. This just goes to show that definitely aesthetic plastic surgery is very, very fast changing specialty, which really forces us plastic surgeons to really stay up to date. One example is actually a paper published this month also in the July-August issue of the Aesthetic Surgery Journal by Paolo Montemuro and Per Hayden and colleagues regarding the use of shaped devices in breast augmentation. And I really think the take-home message for this paper from Montemuro and colleagues is really not about the use of shaped devices in breast augmentation, but I think really should be about how this methodic approach to learning a new technique can really be very useful for younger surgeons to be able to be comfortable with new procedures and with being comfortable implementing them in their practice. I think it's really a paper about how to go through techniques that have initially a complex learning curve, as many new procedures and new techniques are always so. It really requires that you abandon sort of comfort zone about using surgical procedures that you are more comfortable with. And of course, I think that the method described by the authors is really very commendable, and it's very, very well explained in the paper. It's very useful, as Glicksman says, really in her commentary, for any technique that might be needed to implement in the future. There's an excellent commentary by Caroline Glicksman from New Jersey. It goes through the whole process of learning curve of using these devices for breast augmentation in light of these papers that I just mentioned from this year, 2017. Well, one still wonders really the indication for the use of shaped devices in breast augmentation. But then again, and going back to the review paper on breast augmentation by Michael Schwartz from PRS, I totally agree on his conclusions, and I think it's really up to the surgeon and your experience and what you can do best on your hands, of course, knowing all this evidence and reading all these papers. Now, let me just read some of these phrases from Dr. Schwartz. He says, each surgeon will need to evaluate their own clinical experience and approach to best use these devices. Now, he also states, and I cannot agree more, that as in all aspects of our specialty, the blending of art and science serves to advance the delivery of the best results possible to our patients. And of course it is, our specialty, especially aesthetic plastic surgery, is a blend of art and science. It's a responsibility of each of us to really use the scientific evidence to provide the best for our patients, but also to do what honestly is best in your own hands as a surgeon and use the armamentarium that really can provide the best results for your patients. And in this case, if it is the use of shaped devices, then of course that's what you should use in your practice. Now, the next paper on breast surgery is on the August issue of PRS. It's a special topic paper by Nadia Blanchett and Marian Martinovich. Now, it deals with breast aesthetics, which is a fascinating topic. And they have developed what they have called a B-phase method or a framework for evaluating these aesthetics of the breast. Now, B-phase is a mnemonic that stands for bones, footprint, areola, conus, and envelope. I think the authors are mixing a bit two concepts which might be interesting. One is the concept of aesthetics, and the other one is the concept of surgical planning. Now, they're very much interrelated, but definitely there are parameters regarding an aesthetic breast that may be useful for any individual and don't necessarily infer any surgical planning. So basically, like concepts like tissue envelope are definitely useful for surgical planning, but not necessarily such an important factor for breast aesthetics. Now, I think that many authors have talked about breast aesthetics all the way back from the editorial paper in PRS by Gary Brody on the perfect breast, to contributions definitely by Hal Finlay and Philippe Blondil, and of course landmark papers which are extremely important to aesthetics in general, which is a concept such as symmetry. The landmark paper by Rorick back in 2003 on breast and chest wall asymmetries. Also the excellent paper by Alan Gabriel, Patrick Maxwell and colleagues on this topic of asymmetries on ASJ 2011. But I really think the most important contributor of the modern concepts of the aesthetics of the breast is definitely Patrick Malucci with his landmark papers on JPRAS and PRS. Now, I think there's another very important concept in breast aesthetics which has not been mentioned in this paper, and that I did reference to it in my paper in PRS 2015 on parasternal infiltration composite breast augmentation. Now, in that paper, I did argue that there was a very important factor which is the distance between both breasts, determining how natural or how attractive breasts look. And I actually did a little attractiveness study in that paper. I defined parameters such as the presternal light reflection and the parasternal vertical lines, and concepts such as the separated breast deformity after breast augmentation. Now, I think those are very important for attractiveness, the cleavage of the breast, and a lot of times papers dealing with attractiveness only deal with the position of the nipple areolar complex or the fullness of the upper pole with respect to the lower pole, like the important paper by Grant Thomas in 2003, and other authors such as Eric Swanson proposing that a propole fullness and a 50-50 proportion breast is more appropriate than a 45-55. Anyhow, I really think that a lot of times you don't need to see the breast on a profile view to see the upper pole projection or fullness. You don't need to see the areola, and a lot of times you see if a breast is attractive or not just by looking at a woman in her bikini or in a bra in a front view, and this has a lot to do with that area and the cleavage area and how the light reflects in that area. Another concept that I think is also very important, I think it might be like the fourth dimension or the neglected parameter, I think a lot of times in breast augmentation, is the movement or the behavior of the breast with the movement and the softness. And of course this has to do with a Baker classification of capsular contracture, but not necessarily. There's a lot of times where how a breast moves has a lot to do with how attractive or natural it looks. But nevertheless, I think it's a fascinating topic. I really congratulate the authors on this paper. I love the quote they put on the beginning of the paper by Leonardo da Vinci. It says, "Develop your senses, especially learn how to see." And I think we as plastic surgeons should really think about that in all of the procedures we perform. Now, it looks like there's no other papers on the August issue of PRS on aesthetic breast surgery, but there is a very interesting viewpoint article that has to do a lot with breast augmentation by David Hidalgo. Now, the title of the paper is "Sometimes It's Not Your Fault," and it deals with the onset of late hematoma, which of course is a complication in a lot of procedures in plastic surgery, but definitely something that can often happen in subpectoral breast augmentation. Dr. Hidalgo comments that a lot of these patients are very comfortable after the first week and are really looking into getting back to their normal activities. And it is very important to let them know that they do have a risk of developing a late hematoma even at the second week after their procedure. I really like the part of the article where he states some of the activities that he has found his patients to be performing while they develop this late onset hematoma. Let me just tell you some of them. Such varied activities as fly swatting, playing ping pong, opening stuck refrigerator doors, and of course the premature resumption of intimate activities. And I think it's very important to let the patients know that what they do in the post-operative period is very important and can have consequences for the final outcome of their procedure. And the last paper on breast surgery I want to comment on is the one on the Aesthetic Surgery Journal on breast implant-associated ALCL, where the authors state that a CD30 positive result on a late seroma may not be diagnostic of this entity. The paper is authored by dermatologist Marshall Caden and colleagues. It's really a case report on a patient with a late onset seroma after breast reconstruction. Now, the paper is relevant because the authors conclude that CD30 positive expression is not diagnostic of malignancy in late onset seroma. Now, just as important as the paper are the commentaries by two of the most important experts on this topic in the world, such as Mark Clements from Houston and Anand Diva from Australia. Now, the commentary by Mark Clements is quite firm. He actually starts and ends his commentary by "let us be clear and we must be crystal clear." And I think he is concerned, as he states it himself, that, let me read it, "The manuscript's dramatic titles seem to challenge established disease criteria and raise questions about the reliability and accuracy of CD30 positive testing." And of course, this is important because a CD30 positive result is one of the diagnostic criteria to further investigate breast implant associated ALCL. Of course, it is not the only one, and this is what really Mark Clements tries to emphasize. He states that in addition to CD30 expression, you need aberrant morphology and of course clonal population expansion on flow cytometry. The commentary by Anand Diva is also excellent, and he reviews all that we know so far about breast implant associated ALCL. I really love a little paragraph about the debate between Louis Pasteur and Claude Bernard at the late 19th century regarding the importance of the germ theory as the causation of disease. You know, some authors were debating whether it was the germs or some of characteristics of the host that were more important in terms of causing disease. I think Diva brilliantly makes an analogy with that time. And he states that certainly there are some pathogens that may produce a disease on their own, but a lot of them, pathogenic agents, really need a terrain in which to proliferate to be able to cause any damage in the host. In this case, it would be the implant device that allows these pathogens to proliferate and cause the damage that they eventually produce at the end. No? And he also states that this case report presented might be maybe an in-between stage from not having any disease to having a full malignancy, sort of like an in situ cancer. And that's all for the papers dealing with aesthetic breast surgery for these months of July, August 2017. Thank you very much, and I hope to see you next month on Plastica Review.